Thank you very much for joining us today for the second webinar in our Unlock Emotional Healing with Springer Publishing's EMDR webinars, the impact of adverse child experiences, ACEs, on adult health and mental health and implications for EMDR therapy. If you can advance to the next slide, that would be great. Thanks. And my name is Lee Montville. I'm the Director of Special Sales and Business Development at Springer Publishing. Presenting with us today are Ann E. Potter, a certified therapist, an approved consultant in EMDR, and a certified RODBT therapist with over 45 years in the mental health field as a psychiatric nurse, educator, therapist, psychologist, evaluator, researcher, writer, presenter, and consultant, and Deborah Wesselman, an EMDRIA-approved consultant who serves on the editorial board of the Journal of EMDR Practice and Research and has worked for over 30 years treating trauma and attachment problems in adults and children. Deb also co-founded the Attachment and Trauma Center of Nebraska in Omaha, Nebraska. Before we get started, I want to mention that this webinar is being recorded, and if you miss any portion of the presentation, you can find the video on springerpub.com 5 to 7 business days post-event. And if you have any questions during today's webinar, we ask that you please type them into the Q&A box on your Zoom control panel, and I'll bring them up at the end of the presentation. And if you forget to ask a question, there'll be a brief survey sent at the end of the webinar, and you can include your question there. Now, without further ado, we will turn the time over to Ann and Deb.
Thanks, Lee. So today we're going to cover the results of, I think it's 3 or 4 of the studies that uses the Adverse Childhood Events questionnaire to look at childhood experiences and its link to adulthood issues such as health and mental health problems. And then the original ACEs study has 10 questions. The expanded ACEs, which we'll explain, has 14 questions. And we'll go over the similarities and differences.
And then we'll talk about how EMDR therapy is a modality that can help interrupt this generational pattern that we have discovered through the ACE study. And we are going to look at how it can not only resolve early experiences, adverse experiences, but directly interrupt poor behavioral choices around one's health, coping mechanisms that actually shorten lifespan if there is no interruption and intervention.
Okay, so let me tell you a little bit about the original ACE study that was done in the mid-1990s, and it's descriptive and correlational research by the CDC and Kaiser Permanente. And I was just telling Deb, I can't remember the name of the physicians, but there was a Kaiser Permanente physician who was doing treatment for obese and morbidly obese clients or patients. And he was finding that there were so many of his patients that were non-compliant or they would drop out of treatment. And at the same time, there was a physician researcher at the CDC who was doing research, and he was finding a very high number of participants, and I don't remember the study, that had a history of childhood sexual abuse. And somehow the two of them talked and decided to coordinate this study. And as you can see, it was a really large one, 17,000 participants who were covered by Kaiser Permanente health insurance. Now, I'm not going to read each one, but Deb's going to kind of scroll through as I kind of summarize. So it's a 10-question survey about adverse childhood experiences, primarily in the family. So physical and emotional neglect, physical, emotional, and sexual abuse, parental dysfunction, such as a parent with mental illness or substance abuse, witnessing domestic violence, particularly, at least in this version, the male figure towards the female or the mother figure. And then also the loss of a parent, whether it's divorce, abandonment, death, or imprisonment. So the results showed not quite a third of the participants had a 0, an A score of 0, so reported no childhood adverse events. About 48%, so almost half, had a score of 1 to 3, so they were reporting 1 to 3 events. And then 21%, a little less than a fourth, had 4 or more adverse childhood events that they reported. And what they found was there was a correlation between the A score and the adult health and mental health outcomes. So, for example, as the number of adverse events that increased, so did the risk for health risk behaviors and a shortened lifespan in adults. So some of the, oh my gosh, as you can see, some of the negative outcomes on the mental and physical health of the participants who reported these numbers of adverse childhood events, there was traumatic brain injury, and this is a significant difference in comparing to people without the adverse childhood events. So they had an increased risk for traumatic brain injury, fractures, burns, HIV, sexually transmitted infections, chronic illnesses such as obesity, cardiovascular problems, cancer, diabetes, high-risk behaviors such as smoking, alcohol and drug abuse, unsafe sex, unintended pregnancy, pregnancy complications, and fetal death, anxiety, depression, suicide, and post-traumatic stress disorder. They had a more limited opportunities in education and occupation, and their income range was lower or reduced. So you can see in this pyramid, and we're only going to start with the adverse childhood experiences. We'll talk about the lowest 2 levels on the pyramid a little later. So the adverse childhood experiences led to disruptive neurodevelopment, social, emotional, and cognitive impairment, these adoption of these health risk behaviors, which led to disease, disability, and social problems, and then inevitably shortened people's lifespans. So let me tell you a little bit about the study limitations, because the 2 that we're going to talk about later kind of solve some of these limitations. So the participants were predominantly non-Hispanic Caucasians. Almost half of them were 60 years or older. 3/4 of them had at least finished high school and then attended some college or had a college degree. And the other limitation is that adverse child events outside the family were not included. Community, social, and racial factors were not taken into consideration. Okay, so the first one is the Philadelphia Expanded ACE study. And this was about 1,800 people in Philadelphia. And the Urban ACE questionnaire added 4 questions to the 10 we just showed you. Can you move that? They added the adverse child events outside of the family. So exposure to bullying, community violence, poverty, neighborhood safety, experiences of racism, intergenerational and historical trauma, and also living in foster care. And the score of 4 or more was correlated with very significant health risk behaviors in adulthood. So it included a wider diverse of participants. The findings showed, and you can kind of tell the difference, there was about 17% that had an A score of 0. There's about 46% that had a score of 1 to 3, and then 40 or 37% that had a score of 4 or more. And a couple of differences with these added adverse events in the questionnaire. Black adults were more likely to have 4 or more of the adverse events reported, almost 50%, compared to white adults, which was 34%. And 50% of adults living below 150% of the federal poverty level had 50% with 4 or more of the A score, compared to about 32% of respondents that lived above that level of poverty. The Oregon Expanded A study added youth and children in their study, and they found that, as you can see, again, the children with the higher A scores were more likely to experience anxiety, depression, ADHD, developmental delays, social, emotional, cognitive issues, academic challenges, and specialized health needs. Can you go back to the pyramid? So those 2 expanded studies added the 2 lower levels on the pyramid, where they looked at social conditions and local context, and they also looked at generational embodiment and the historical trauma. So those 4 added questions covered more of the social environment, generational, community adverse events.
EMDR therapy is one of the most useful methods that we find to address adverse childhood experiences and the resulting challenging, unhealthy behaviors that can shorten lifespan. So overall, EMDR therapy addresses 3 prongs of past, present, and future. And why this is important is because it doesn't just stop at addressing the past. It also helps actually directly change the behaviors, the responses to present day triggers and stressors, and integrate new behaviors, new healthy behaviors to lengthen lifespan.
I know we spend a lot of time focusing on how EMDR helps people in adulthood have healthier relationships, intimate relationships, friendships, work relationships. And it's really wonderful to see how it also impacts individual health behaviors, health risks, etc.
And if my relationships are healthy, I'm using my relationships as a source of strength and support and coping, then I am less likely to turn to the unhealthy methods of coping. So EMDR therapy has been endorsed by organizations all around the world. For example, the International Society for the Study of Trauma and Dissociation, ISSTD, the World Health Organization, and these should have had their own bullet points. United Kingdom's National Institute for Health and Clinical Excellence, NICE, and the Department of Veterans Affairs and Department of Defense. And now, well, for several years now, EMDR for children is endorsed as an evidence-based treatment by the California Evidence-Based Clearinghouse for Child Welfare. So the beautiful thing too about EMDR therapy is it addresses not just symptoms of PTSD, not just the reliving or the nightmares, the flashbacks. It addresses all the myriad of symptoms that can result from early adverse experiences. And EMDR therapy does not just address trauma that meets the criteria for the criterion A trauma definition in the DSM-5, which is more endangered, life risk, so abuse or in the presence of domestic violence, but it also addresses what Francine Shapiro used to call the little t trauma, the criticism, rejection, discrimination, alienation, those kinds of experiences, which also have severe long-term impact, as evidenced by the ACE study. So here are some of the problems associated with adverse childhood events. PTSD, yes, but also conduct problems, depression, eating disorders, anxiety disorder, grief, personality disorders, phobias, self-esteem problems, suicidal thoughts, and more. And anything that is rooted in early adverse experiences has positive impact when treated with EMDR therapy. Interrupting unhealthy health behaviors through EMDR therapy is addressed through several protocols, and I'm going to go over just briefly 1, 2, 3, 4, 5, 6, 7 of them, just briefly. Resource development and installation is a preparation phase EMDR method that actually enhances positive internal resources. Positive internal resources, qualities such as just strength or confidence, trust, the capacity to be assertive, to communicate, coping capacities. And it does this in a very, very safe manner early in therapy before even addressing the difficult memories, using the slow BLS, which deepens the positive affect and avoids actually starting any reprocessing. So this can be done right at the get-go. So this is one of the protocols. Second one is future rehearsal. And future rehearsal actually is built into the RDI protocols. We take those resources and help people bring those resources to challenging situations and integrate those resources into their responses to those challenging situations. But there's a really great future rehearsal method developed by A.J. Popke years ago. And this method actually enhances a positive future state related to healthy choices and positive emotions. And it's specifically developed for people who have compulsive behaviors in the area of addictions like substance abuse or alcoholism, or other kinds of behaviors like overeating or any kind of gambling,
Spending.
yes, spending, that's right. Sexual acting out. So there's a lot of ways that this can be utilized.
Can I give a couple examples?
Yeah, sure.
So I worked with a client who actually was rejected for gastric bypass surgery. I can't remember which level it was, because she didn't have confidence at all that she would be able to follow through with the, very strict regime after the surgery. And so she came to work with me. And one of the things we did was help her develop some internal resources that would be helpful to her to be able to link a sense of competence and confidence to her ability to change the way she saw herself, and also, for example, her health habits like diet and exercise. And what I found was she had cognitions that got in the way. And that's, Deb will talk about that in a minute. So I don't deserve to be healthy. I'm a failure. I'm never going to get this, all of those kinds of things that were rooted in childhood events and beliefs that she had had since childhood. And then we did future rehearsal where I had her imagine herself at a time in the future where these new behaviors, these new health behaviors were just automatic. She didn't even have to think about it. And then that really allowed her, as she watched and she felt going through behaviors that would be healthier for her, then that really, really strengthened the connection to her sense of competence and confidence. And it helped her start changing those negative beliefs. So I deserve to be healthy. It's safe for me to be thin. I love being active. I can do this, those kinds of more encouraging and positive cognitions.
Even before you address the
Yes,
memories.
even before we got to reprocessing any memories.
Yeah, that's so great. So more about directly decreasing unhealthy coping patterns that impact health and mental health through these more advanced EMDR protocols. The detour model, back to the detour model, also has a specific protocol for targeting the triggers to the urges and compulsive behaviors. So, for example, then after doing that work, you can move, even before addressing the memories, you can move to the triggers for, reaching for something sugary to cope. Maybe it's a trigger like somebody coming down on them at work or something. Yeah. What were you going to say?
I was going to say, or what I find with people who have problems with food, especially, is, somebody brought, a couple of dozen donuts and it's sitting out in the break room where they know they're going to pass by.
Yeah.
But yeah, I like your emotional one.
Or an emotional one. And you can actually target that urge. And instead of a SUD, you get a level of urge. And I refer you to AJ Popke's work to learn more, but you can actually then reprocess that urge and bring the level of urge down from whatever it is, a 9, 8, 9, 10 to a 0. And you do that for every urge.
You do FSAP.
Oh, yeah, go ahead. Do FSAP.
Are you ready?
I'm ready. So the next one, I'll let Ann take over. She loves this one.
I use it all the time.
I do too. It's great.
I actually, until I did the training, I'd never even thought about all the positive feeling states we have related to unhealthy health, high risk health behaviors.
Yeah, you wouldn't think
You wouldn't
positive
think.
feelings,
I know,
but yes,
especially because by
Yes.
the time we get to be adults, a lot of times we're experiencing all the consequences of however many years we've been doing this behavior that's not good for us. And it is hard to believe, but at some point, so it's called the feeling state addiction protocol. And I've used it with smoking, drinking, food, overspending,
stealing, pornography use.
and the what you identify is some of the original positive feeling states that got connected to the behavior. So in the beginning, people didn't, when they're 12 years old and they're hiding behind the school smoking cigarettes, or vaping, they're not thinking, oh yeah, I'm going to shorten my life and I'm going to get lung cancer, or I'm not going to be able to breathe right, or whatever. They think, oh my gosh, the positive feeling state is I feel more relaxed. I have this sense of belonging, right? Because I'm in this group of other kids that are doing the same thing. Or I mean, there's a whole bunch of positive feeling states. And that's what we break the link to. Because when you break the link to the positive feeling state related to the behavior, what's left are the negative consequences, right? So the positive, it's, I don't know if you ever use this, but it's called spitting in your soup, which is you just kind of wreck it. Like they don't have the endorphin or the dopamine or whatever flush that they used to have. They're just like, oh, because you've broken the link. And then it also then goes into reprocessing the traumas related to people's need to get those needs met in adult life. So you do have a need for belonging.
Yeah,
right.
Exactly. Where did that strong need for that pleasurable feeling come from? Well, then that traces back to the early adverse events. And you do, with both Detour and FSAP, you do ultimately go back and, well, I'll get to that.
And I love these because you're gonna get adverse childhood events that are connected to the high risk behaviors.
Yeah.
Instead of like a touchstone, well, you do go back to a touchstone event, but it's related to the health behavior.
You find the most relevant memories when you take that urge and that need and you float back to the first time or where that came from. You get the most relevant memories related to those unhealthy coping patterns.
And right with either one, you find people, and in FSAP, Dr. Miller said, the goal is not to quit. The goal is to lose interest.
Yeah.
Which then means they decrease or quit the behavior because it doesn't do what it usually did for them before.
And I referenced Jim Knipe here, his EMDR toolbox. He also had identified targeting maladaptive behaviors or maladaptive positive feelings associated with maladaptive behaviors as a protocol. So he also gets some credit on that. And then EMDR breaks the links between the adverse childhood experiences and persistent negative self-beliefs and adult health patterns through the standard protocols. EMDR therapy does reprocess past adverse events to eliminate associated disturbance and find new meaning. And there's now we know just from all of the research out there, and there's a ton of it, that the EMDR therapy actually has more than one mechanism of change at work. It's doing more than one thing in the brain that actually reduces or eliminates the emotional charge and connects that memory network to good adaptive information from present life. And it takes that, integrates it with the memory and stores it into long-term memory where it's no longer causing activation. And there's so much research now. They're doing PET scans and other scans before, during, and after EMDR therapy, and they actually can see the changes in the brain, in the limbic brain, in the prefrontal brain. There's actual changes that happen structurally, functionally over time. So it's very exciting to see that research coming out. But these adverse events often have very strong, stuck negative beliefs, kind of stuck in the brain along with the event, like I don't deserve, like Anne had mentioned, or I'm not safe, I can't trust, I don't belong, I'm unlovable, I'm powerless. There are so many.
I'm defective.
Oh,
There's no way I have what it takes to be able to stop smoking, change this,
Yeah.
do this.
I'm weak.
I'm weak.
Yeah. And then because it's a three-pronged approach, it also eliminates the triggers related to those traumas. So, for example, that's where relationships come in. Often the triggers related to the traumas are the relationships in present life, because I don't trust and I don't feel lovable and I feel helpless and powerless. And so my behaviors in relationships are to overreact to things or over control or to avoid closeness. So all of that.
And then that just reinforces the old negative belief. Like there's a voice even that says, well, what'd you think was going to happen? Or I told you so.
And then we develop, related to each of those triggers, we develop positive templates for new healthy responses to the triggers. So you can see EMDR therapy really comes at these adverse childhood experiences and the unhealthy present day behaviors in multiple ways. So we can interrupt unhealthy behaviors and extend lives. And by the way, we can also do that with children. So just imagine how many children can have their trajectories completely changed so that they never have to start using drugs and alcohol and unhealthy sexual behaviors and all those things that shorten lives. Or they don't have to generationally pass on their maladaptive, abuse, neglect, the unhealthy child rearing patterns. They don't have to pass those on to their own children. So we can really make a difference. And these are the study references, and we have EMDR therapy references. And now we're ready for questions. Yeah.
Excellent. Thanks, Anne and Deb. We really are, this was incredible. Excellent and informative presentation. As I mentioned before, we'll go ahead and take some time for questions now. We have a lot of questions that were put into the Q&A, and feel free to put some more in there. Please type them into that Q&A, the question box on your control panel. So the first question is from Kimberly. She said, where can I obtain the most up-to-date ACEs questionnaire?
I think you can obtain it right from the CDC website.
Yes.
Yeah, U.S. Centers for Disease Control.
And there actually is, if you type in a study, they have a whole page on all different aspects of it.
Perfect. The next question is from Shirley. Shirley would like to know what people are using to assess ACEs in older adults. They are doing a study of food insecurity among older adults with cognitive impairment.
Wow.
Mm.
Well, that has multiple layers.
Yeah.
But as far as I know, the ACE questionnaire is what you would use for older adults, any adults. So the cognitive impairment would probably be the biggest issue.
That would be the biggest issue. And I would have to research that myself. I wonder if that's even been done yet.
Or maybe they're the ones doing it.
Yeah.
Are you guys doing
Are
it
you-
yet? Oops.
Is
Sorry.
the person who asked the question doing this? I wonder. So that is something I cannot answer.
Yeah,
And
Right.
Go ahead.
Oh, what Lee was about to say something.
No, I mean, hopefully they can put something into the chat regarding that, but we can certainly follow up,
Okay.
separately after this.
Yes, I was thinking you might have to look at level of reading ability, and whether or not the questions would have to be read.
Yeah.
Makes
Okay.
sense. All right, the next question is from Jacqueline. Jacqueline asked, how does a new study get initiated? I believe there'd be elevated percentages in recent years.
And they are continuing the studies. If you go to the CDC website, you will find there are several states involved in continuing taking this data from their populations.
So it's longitudinal.
Yes, so that it's longitudinal. So the data is out there. They are continuing to take data in several states. It's quite impressive how many states have gotten involved.
And we have references for the Philadelphia study, the Oregon study, and the child study. And I would suggest linking to them and see, what their resources are, references, and contact people. I think it's unbelievably powerful.
Perfect. The next question was from Anonymous. So do the research studies include randomized control trials suggest that EMDR is not good for any condition brought to therapy, except perhaps some psychotic issues through perhaps even those?
So I would refer you to the Francine Shapiro Library. You can Google that, or you can get to it through EMDR, EMDRIA, the International Association of EMDR. And there are multiple studies out there on so many different conditions. I would have to refer you to the library to find out regarding randomized controlled studies and specific conditions. Yeah.
And you've got a reference for her on the list, on the EMDR list?
I have her book,
okay,
I believe, on the EMDR list. But again, we can address that with you. The Francine Shapiro Library would be a good one to give to you, so that you could just get right to it. But I think you can Google it and find it. You can put in whatever type of condition you are interested in, and find out what are the studies around that.
And our colleague Gina Martinez has put in the chat the link to EMDR.com. And of course, as you mentioned during your presentation, there are other EMDR authors such as Jim Knight, who we publish, and there are other resources on our website as well.
Oh,
for
good,
folks.
good. Yeah, great.
And we had a couple people ask about books, trainings that were recommended regarding using EMDR in practice. So that's also something helpful for folks as well. Our next question was from Simeon or Samoan. How do you help individuals who feel powerless to systematic oppression or racism?
Mm. That's a big topic, but I would say that I would address their experiences with racism as trauma and reprocess those as trauma. But I think the concern that I'm hearing is they're going to go back out and maybe continue to have these experiences. Well, they will, obviously. There is EMDR research that some EMDR research done with children in the Middle East that were exposed to war that showed that children, they followed up with these children and they had a control group. And they found that the children who had experienced EMDR on their traumatic war experiences were more resilient to the experiences that they had later on, more resilient than the children who had not experienced EMDR. So we do know that reprocessing those traumas that they have had brings more resilience to the next time. So that's good information to know.
And I don't know, Lee, if you guys have a book about EMDR treating racism, equity. The author I'm thinking of that you would want to look up is Mark Nickerson. And of course,
we do. And actually, I
Okay.
work with Mark a lot. So we do have Mark's cultural competence.
Yeah.
And my colleague Gina can put the link to that in our.
It's an
in
excellent book. Yeah.
It is. And the new edition just came out.
Yeah.
within a couple of years.
To techniques for utilizing EMDR to reprocess those types of trauma, he also addresses beautifully our own biases, prejudices, and how to create an equitable relationship with clients.
And a safe environment for clients to be able to talk about these things. You know, if I as a therapist, I'm, white from a privileged kind of community of white people. And so he addresses how we can help, even though we haven't had those experiences, through just, remaining very open and humble about our limited knowledge and our limited experiences, and being just willing to learn and learn more. So yeah, it's a huge topic.
Great. Our next question is from Randy. Do you have any recommendations for serving persons with developmental disabilities? Any specific modified protocols?
I would refer you to, there's I think it's a Springer book that I've just done a second revised chapter for. And it's a book on all evidence-based approaches with children. And there is an article by myself, Francine, Carolyn Settle, and Lisbeth Mevison from the Netherlands And her piece is about treating adults or children with cognitive, intellectual disability or autism and utilizing an adaptation with EMDR therapy. And I would refer you to that or to her articles, which can be downloaded from the internet. So it's Lisbeth Mevison, Mevisen, is the author of these articles about this approach. And it's a storytelling approach. It's actually using the Joan Lovett storytelling approach. So that is a great tool. Yeah.
And I was just going to add, so for children, we publish Anna Gomez's EMDR therapy and adjunct approaches with children. We publish Anne Beckley Forrest and Annie Monaco's EMDR with children in the play therapy room. And we publish EMDR and the Art of Psychotherapy with Children, which is by Robbie Adler Tapia and Carolyn Settle, who you just mentioned. So the next question is from Alma. And Alma asked, how do you recommend transitioning from talk therapy to EMDR modality?
It's really an easy transition, honestly. I say to clients, wow, we have really uncovered a lot of stuff that I think we could address with a method that is evidence-based. It is a method that I use with lots of folks, and it's called EMDR therapy, and lots of people already know about it. It's amazing how many people say, I've heard of that. I had a friend who did that.
Or
I'd like to try
saw
that.
TV special with so-and-so, movie star, and they said they did EMDR therapy.
Yeah, even stars have come out and talked about their own EMDR therapy. Yeah.
And honestly, I remember Deb and I got trained back in the day. And I remember we were told during the reprocessing phases to get out of the way so that we're not kind of interrupting the client's process. And we've learned with attachment trauma, complex trauma, developmental trauma, that the relationship that you've built with the client up until that point, that sense of trust and safety, that it helps move people into the reprocessing phases more easily. And I tell people how it's going to be different, because it is a little different than talk therapy.
And I tell them the beauty of it is you tap into your own internal resources for healing. And we always tell people that we have an unshakable belief that they have what they need inside to heal.
Excellent. We have just a couple more questions for you. A question we received was, how do we know that recovered memories have any more validation than those discovered with hypnosis? And we know the problems with those.
I never, ever help people search to recover memories. That's not at all what I would ever do or recommend. People remember what they remember. And sometimes they'll maybe have a memory come up they say, oh, I forgot all about this, or boy, I had pushed that to the back of my mind. But it's never a goal to uncover a memory, a new memory, because we don't want to cause any kind of false memories, of course. So that's just not what we do.
Well, and I mean, my concern is that if there's something uncovered or recovered through a technique, then my question is it actually a memory? or is somehow whatever it is that I've just done as far as the technique goes, has somehow produced this memory. So I mean, you're getting my biased opinion.
Yeah,
but
my bias too is I just would never,
I don't try to recover memories.
no, not at all. But I'm glad that the person asked that
Yes.
question, because that's, I think, an important point to make, that we don't want to do that.
That's great. And then Angela has asked, is there a correlation between an ACEs score and attachment style?
Oh, I don't know. Have they studied that?
Nobody studied that as far as I know, but my opinion, I can give you my opinion. My opinion would be that there would not, that the correlation would be that somebody with a 0 would be much more likely to have a secure attachment pattern. But I don't think we could say that it would be more, well, definitely, or that people with higher scores would be more dismissive or more preoccupied, which way they would go, there's,
But they might have a non-secure.
but they definitely might have a non-secure pattern. My opinion would be definitely, I strongly have an opinion, I guess, that people with a higher score would have a non-secure pattern of attachment.
Well, and when you look at those 10 questions, they're all the things that when we're assessing attachment and attachment trauma, so that the trauma that happens with attachment figures, whoever the person is being raised with, those are all the, what's the word? Risk situations for a non-secure attachment pattern.
Yeah.
I don't think anybody's done that.
No, I don't think
That'd
anybody's done
that'd be
it.
a great study.
Yeah.
That's
And
great.
disorganized would be
Yeah.
a big one, just because that's often, related to a child who's fearful of the parents. So, okay, go ahead, Lee.
Perfect. I was going to say, if you can move to the next slide, that would be great. I think we've gone ahead, and thank you both for taking the time to answer all the questions. We're almost at the hour. So
Please, feel free, if you didn't get a question answered or you have another question, send it somehow. And
yeah,
I think he's going to talk about that.
okay.
yeah, exactly. Yeah. Thanks for this.
And we'll get back to you through them.
Right. So any questions that people have, you certainly can reach out to us. Both Gina Martinez and I, Lee Montville, have put our email in the chat. So feel free to send any questions you have. And we want to thank everyone for spending the time with us today. And thank you again to Ann and Deb for such an amazing presentation. As you can see on this slide, if you're interested in purchasing the presenter's book, EMDR and Attachment-Focused Trauma Therapy for Adults, you can receive a 25% discount using the discount code webinar24 at checkout on Springer Pub. And I mentioned in the chat that if anybody's interested in ordering in bulk, feel free to reach out to me, because I can work with you if you're looking to order 10 or more copies of their book. I wanted to also add that the recorded session will be available on Springer Pub within 5 to 7 business days from today, because multiple people asked about that. And, thank you again to Ann and Deb for such a wonderful presentation today. It really was excellent. And we want to wish everyone a great afternoon, and we look forward to having you join us for future Springer Publishing webinars, including our EMDR series. So thank you again for attending. Thank you, Ann and Deb.
Wonderful.
Thank you.
And we will see you all again soon. Have a great afternoon.
Take care.